tonsil infections are common among children in Albany. When these glands in the back of the throat, which aid the immune system by protecting against bacteria and viruses, swell and get infected, pain and agony ensue. There are some things you can do at home to help your child feel better and recover faster. What exactly is tonsillitis? Tonsillitis is the medical word for a tonsil infection. The majority of cases are caused by viral infections, with bacterial infections accounting for 15 to 30% of the time. Who gets tonsillitis the most? Tonsillitis is more common in children than in adults. The tonsils serve an important function in protecting the body from pathogens when we are young, but they shrink with age. Tonsil infections are uncommon by the late adolescent years. Consuming warm liquids. Soup, broth, and tea are all good for coating and soothing a sore throat. Ingredients included in many herbal teas, such as honey or glycerin, promote the creation of a protective layer over the mucous membranes of the mouth and throat, which helps reduce inflammation. Consuming cold foods. In the past, children were offered ice cream as a prize for having their tonsils removed. There was some logic to this. Cold, soft foods numb the throat, relieving pain. Aside from ice cream, frozen yogurt, popsicle, and smoothies will also do the trick. Hard meals should be avoided. Foods with hard or sharp edges, such as potato chips, crackers, cereal, toast, apples, and carrots, can scratch and irritate the throat, exacerbating swelling. Stick to soft foods instead, such as Jell-O, mashed potatoes, and scrambled eggs. Using salt water to gargle. A saltwater gargle might help relieve throat pain. It's simple to create. Simply dissolve a quarter teaspoon of salt in 8 ounces of warm water, swirl, and gargle for a few seconds before spitting the water out. Making use of a humidifier. Using a humidifier or vaporizer to add moisture to the air will help soothe a dry, scratchy throat and reduce pain. Don't have one? Turn on the shower, check the water temperature, and close the bathroom door. Inhaling the warm steam has the same effect. Taking a breather. When your throat is enlarged, speaking, or even whispering, exerts tension on the vocal cords, causing irritation. The best thing you can do is relax your voice by speaking as little as possible. Getting enough rest. Rest allows your body to strengthen itself in order to fight infection. Staying in bed for a few days instead of going to school, where your child is at risk of infecting others anyhow, will help your child recover faster. Using over-the-counter analgesics. Ibuprofen and acetaminophen can relieve throat pain and discomfort. Don't give aspirin to youngsters since it can trigger Reye's syndrome, a potentially fatal sickness. Taking throat lozenges. Throat lozenges and cough drops frequently contain menthol and other anesthetic drugs that numb and soothe the throat. To avoid the danger of choking, limit these to older children. The use of throat sprays. Over-the-counter throat sprays containing benzylamine, phenol, dibucane, benzocaine, benzyl alcohol, cetylpyridinium chloride, and chlorhexidine gluconate may give your child fits in the spelling bee, but their anesthetic, anti-inflammatory, and antiseptic properties are excellent for pain and inflammation relief. These home cures should make your child feel better, and their tonsillitis should heal up in a few days. Make an appointment with an Albany ENT doctor if it lasts more than 3 or 4 days or is accompanied by extreme discomfort, difficulty breathing or swallowing, weakness, exhaustion, or a fever that hasn't broken after 3 days. A sore throat is characterized by throat pain, itching, or irritation. The predominant symptom is throat discomfort. When you try to swallow, the pain may worsen, making it difficult to consume foods and beverages. Even if your sore throat isn't severe enough to warrant a trip to the doctor, it's still uncomfortable and may keep you from getting a decent night's sleep. You can relieve the discomfort and irritation using at-home solutions. In general, the therapies discussed below may help relieve a mild or usual sore throat. If you have a severe sore throat, especially if it is growing worse or has lasted many days, you should see a doctor to discuss your symptoms.